The first two, we had 2 nights, we had beef stew, nice pieces of beef and carrots and stuff in it, and one night mutton stew, stank.
Mutton seemed to be pretty popular back then. It was available and cheap, I think.
Yeah, and I went down to, they had like a PX in one stateroom, and I bought a box of Fig Newtons. I loved Fig Newtons.
Bet you were popular that day.
And I used to sit in the hall. At breakfast we went because it was scrambled eggs, and breakfast was good. They couldn't ruin that. Mm-hmm. But the dinners and stuff were terrible. I'd go down and get the big Monisque cup full of coffee and come back, and we'd sit in the hall, Freddie and I, and dunk these Fig Newtons. But boy, did I get the shits from Fig Newtons. And
I take it your voyage over wasn't unpleasant, wasn't too bumpy for you?
No, it wasn't. It was fairly smooth. Mm-hmm. And one night we're sitting in the hall, Fred and I, with our back against the wall and stuff. He didn't want to go in the stateroom, and I felt the ship stopping. So I got up and I opened the door into our stateroom.
Did you have a window in there?
They had the porthole, mm-hmm. Big one. Mm-hmm. And it had a sign, "Do not open." The 2 guys...
Good morning, and thank you for joining me today. We are going to announce today our updated nursing home guidance as we continue to assist nursing homes amidst the COVID-19 pandemic. But before I go over those details, what I'd like to do is to thank the many partners who are assisting us as we help nursing homes during this unprecedented time. First, the Pennsylvania National Guard and the brave and courageous guardspersons that are assisting us in these facilities, as well as general healthcare resources, and they are both providing critical crisis staffing and testing support to facilities in need. Our partners, CVS Omnicare and Eurofins, who are also supporting testing needs in skilled nursing facilities. Our consultant, ECRI, who continues to provide infection control consultations to facilities, as does the Patient Safety Authority. The RICS, or the Regional Response Healthcare Collaboratives, through the Department of Human Services. And we discussed this just a couple days ago with Secretary Miller. And they continue to provide testing, rapid response in case of an outbreak, technical assistance and education for nursing homes and other long-term care living facilities. PEMA, the Pennsylvania Emergency Management Agency, who we work very closely with as we evaluate what support might be needed in facilities and whether staffing or from a supply perspective. Quality Insights is working with us in terms of the facilities on infection control. The Medical Reserve Corps and the Department of Human Services have provided virtual mental health services to facilities. We appreciate our collaboration with the Pennsylvania Department of Aging, as well as the long-term care ombudspersons. We'd like to thank the CDC and the Federal Department of Health and Human Services, who have both sent teams that have provided on-site assistance. And I'd tremendously like to thank the many Department of Health employees who have worked to assist nursing homes. And this includes our quality assurance team that oversees these facilities and do inspections, our healthcare acquired infection team, as well as our team of dedicated public health professionals, all joining together to help assist these nursing homes and other long-term care facilities to protect their staff and to protect our most vulnerable Pennsylvanians. Now back to the guidance. This guidance provides revised recommendations on several different initiatives, including compassionate caregiving and when residents and staff of nursing homes should be tested for COVID-19. We have heard from many stakeholders, from families and others, about how the pandemic has affected the emotional and mental health of the residents of nursing homes, which is in turn, of course, has a significant impact on their physical health. Compassionate caregivers can be family members or others, and they play really a very important role in improving a resident's mental, emotional, and physical health. Compassionate caregivers will be permitted to provide care to residents if there are 2 or more documented changes in a resident's condition. Compassionate caregivers must follow requirements which include providing proof of a negative COVID-19 test result within the past 7 days. They must undergo a screening, which is a temperature, etc., and they must wear a mask in the facility. Now, regarding testing, it is important to emphasize that residents and staff who appear symptomatic with COVID-19 should and will be tested immediately. If an outbreak is occurring in a facility, then universal testing should occur and will occur rapidly to determine the spread of the virus, and then we will intervene. For facilities not experiencing outbreaks, which is they have no cases, we're using a low, moderate, and substantial activity level to inform our testing strategy, as per the guidance and the data from the Centers for Medicare and Medicaid Services, and they released this guidance August 26th. So now we're here today. Facilities in a county with a low activity level are recommended to test asymptomatic staff every 4 weeks. At this time, CMS and ourselves are not recommending testing asymptomatic residents in counties with low activity level. For facilities in a county with moderate activity level, we are recommending testing of asymptomatic staff once a week. We are encouraging weekly testing of asymptomatic residents who have had outside contact in the past 14 days in these counties. For facilities in a county with substantial activity level, we are recommending testing asymptomatic staff twice a week. And this is in accordance with the guidance and the data from the Centers for Medicare and Medicaid, or CMS. For facilities in a county with substantial activity, we're also recommending weekly testing of asymptomatic residents who have had outside contact in the last 14 days. As I've said numerous times, we have to be very cautious. We know that COVID-19 enters a facility through the dedicated and brave and courageous staff who are asymptomatic and through no fault of their own bring it into the facility. And so what we have to do is protect those vulnerable Pennsylvanians. And that is why the spread of the virus in our communities directly influences what occurs in the nursing home. The prevalence of cases in nursing homes is directly proportional to the prevalence of cases in the county in which they're located. And that is also why it is so important for everyone to wear a mask and follow the usual guidelines and recommendations that I'll be going over at the end. In addition, the department has provided updated information to nursing homes regarding visitation and the reopening process. Our work to protect residents and staff in long-term care facilities such as nursing homes is far from done. We all have a collective responsibility to prevent the spread of COVID-19, and we must be united in this effort. Please remember that you are stopping the spread of COVID-19 when you wear a mask in public. You are stopping the spread of COVID-19 when you use hand sanitizer or wash your hands. You are stopping the spread of COVID-19 by social distancing and by avoiding large public gatherings. It is essential that we remember these items. Wearing a mask, washing your hands, social distancing, avoiding large gatherings, especially as we approach the Labor Day holiday. And of course, what's most important for Pennsylvanians always to remember, stay calm, stay alert, and stay safe. Thank you. And now I'm pleased to answer questions. Yeah?
Revised guidelines such as the ones, like say the low activity counties, you're not recommending testing asymptomatic residents.
Correct. That's what CMS and us following CMS guidelines are not recommending asymptomatic residents, but we are testing all staff members every 4 weeks.
I need to get your opinion on, do you think that that recommendation is driven by either a shortage of testing or perhaps the cost of what it would cost to test all those people? And in an ideal world, would you test more?
No, I think these are very reasonable. So we're talking about counties. So, for example, perhaps northern tier counties in Pennsylvania that have had, really low community activity of COVID-19. And I think it's very reasonable to continue to test the staff because they're the ones who routinely leave the facility, but not necessarily to test the residents. We're going to be switching over much more to, and we've talked about this, the antigen tests. All of the nursing homes in the state will be receiving the antigen test machines from CMS, and all at once. There'll be a rollout of that. And that will improve the ability to do that testing significantly because it's going to be point-of-care testing, and we'll have the results pretty quickly. So we're looking forward to that. We've heard of no shortages of the supplies. They'll be getting some supplies from CMS, but then we're going to be having to work with the nursing homes in terms of getting more supplies, more of the kits to do that testing. So I think this is a very reasonable recommendation, which is why we're agreeing with CMS in terms of its implementation.
And the recommendation applies to the antigen test also.
Yeah, this applies to all the testing.
Okay.
Not just PCR testing, which is what we've been doing, but this would also apply to the new antigen test machines that nursing homes will be getting. Yeah.
Can you just give an update on antigen test technology? Because
Sure.
I know that in the spring there were some concerns about the sensitivity and accuracy of the test. So where are we now?
So I think that things have improved significantly in terms of antigen testing. I think that they have to be used correctly, all these tests have varying sensitivities and specificities, and it depends upon who you're testing and under what circumstances you're testing. Whether you're testing asymptomatic individuals or whether you're testing people who have fever, cough, and shortness of breath, and so they kind of vary. But there are a number of different antigen tests that have now been approved. This includes the two machines that are being sent to the nursing homes, but we've also heard approval of the new Abbott card test for antigen testing, and there was an announcement from the Assistant Secretary of Health about distribution to the states of those cards. We haven't heard a lot of detail about that yet, but we're looking forward to hearing more information exactly about that rollout. And of course, we had 2 weeks ago, the governor and I were with with OraSure, the CEO of OraSure, which is a Pennsylvania company, producing another rapid antigen test, and they're getting a grant from the Department of Community and Economic Development, and we're looking forward to their rollout, which they said would be before the end of the year.
Thank you.
Sure. Yeah.
The regional collaborative organizations, they're getting $175 million from the state.
Yes, that was through the legislation passed by the legislature, signed by the governor.
What's your expectation in terms of how much of that money is actually expected to directly benefit the facilities through buying things such as equipment or testing, as opposed to the administration costs or salary costs on the end of the organizations themselves?
So I don't have detailed information at my fingertips in terms of their budget. In terms of buying things, that would be PPE. That would be having PPE for the facility. But most of the money is going towards doing testing. Much of the testing that was done for the facilities that are regulated by DHS, as Secretary Miller talked about, was through the RICs. In addition, though, that is the personnel to come and do infection control training. That would be the personnel to come and do to be part of a strike team to go into a facility. That would be money to help in terms of staffing costs if a facility has difficulty staffing. So it's less stuff than it is activities that protect residents in nursing homes. I'm sure there's some administrative costs, but I think really the vast majority of the money is going towards activities by their staff to help the residents.
For example, the nursing homes are concerned about the sustainability of the level of testing that they need to do. It sounds like a lot of this money will address that exact problem to make sure that they can afford to do enough tests, correct?
Right. That is correct, but I think that the cost of testing is significant, and it is a challenge. But I think that the antigen testing, the antigen tests are much less expensive than the PCR tests, and so I think those machines coming to the nursing homes as they roll out will be a significant help and will drive down costs because it's far less expensive. You had a question first.
You had mentioned at the end about visitors, that you were updating some guidance for visitors. What is that? Is that going to be something that are permitted? I know you said that, if there's some change in the behavior of the resident that...
Well, so the facilities can have visitors now. I mean, there are facilities that have followed the guidelines that we put out earlier this year that have visitors now. It depends upon where they are in their testing. Now they've completed all their testing, and if they haven't had any positives after, I believe, 2 weeks, I don't have it in front of me, they can start to have 2 to 4 weeks. They can start to have visitors. That is being implemented right now. But we also have had specific these recommendations in terms of compassionate care, even if they're not at that place. Even if they haven't completed, they haven't gone through that whole section so that they can have visitors, we're separating compassionate caregivers as a separate category at this time. Yeah.
So, antigen test, that's basically an antibody test, right?
No.
No, they're different.
They're completely different.
How is,
Sure.
What's an antigen test?
Sure. So there are 3 tests. First is the PCR test, polymerase chain reaction. That's a test for the nuclear material, like the DNA of the virus, and that is the gold standard test for presence of the virus. Another test for the virus are antigen tests. So unlike looking for the DNA, they are looking for surface proteins. So it's a test of the surface proteins for presence of the virus. Different type of technology can be done more easily with rapid tests, although there is one rapid test, PCR test, that Abbott that came out a while ago. But most of the rapid tests now that are coming out are the antigen tests. An antibody tests, that is testing your immune response to the virus. That is a blood test, and that is testing to see whether you have antibodies to the virus. Now, we're still learning a lot about those antibodies. New information comes out every week about the antibodies, how long they might last, but you don't necessarily have to have the presence of antibodies to have immunity, because our immune systems are quite complex and have other types of mechanisms. So the antibodies tests are not as clinically useful at this time. There are some antibody test surveillance being done by the CDC. For instance, they're checking, including in Pennsylvania, the results of tests that were done for completely other reasons to see who might have antibodies. And there are a number of different ways that those tests are being done. So 3 different tests, all a little bit different.
Okay, so why, you may have said this to David, but
Yeah.
why antigen tests and not PCR tests if PCR is still the gold standard?
Because the antigen tests can be done much more easily point of care. I mean, you can't do a PCR test in a card. And the tests that are coming out, the Abbott antigen tests that are coming out that were discussed by Admiral Giroir a couple days ago are like a card. And it can be done really, really simply with results really quickly. You cannot do a PCR test that way. And so this ability to not even need a machine will increase the ability for us to do more and more diagnostic testing, but also more and more surveillance type testing. And they're fast, they're less expensive, and they're easier to use.
Is there a trade-off though, still in accuracy, even though the antigen tests are improving?
Yes, it depends upon the circumstances. Each one is a little bit different in terms of their sensitivity and their specificity. So there's always kind of a trade-off. And so, we're at all the state health officials, through ASTO, the Association of State Health Officials, and then our teams, we're all looking at these new tests, which were just announced a couple days ago, and exactly how we're going to use them and how we're going to distribute them. We have not received them yet. Yeah.
Compassionate caregivers you mentioned at the beginning. Is that family members?
It can include family members, but it is not doesn't have to be a family member.
And Could you just go over the requirements that they need to meet before they would enter the facility?
Sure. Well, so you have to be a compassionate caregiver, and then you have to, let's see, you have to have proof of a negative COVID-19 test result within the past 7 days. You have to undergo a screening, which is usually like taking your temperature, like we do here, and you have to wear a mask. Yeah, and of course, wash your hands and things like that. Yeah, you have a follow-up.
The CDC, we had reported last night that they said to state officials to be prepared to distribute a potential vaccine as soon as October. Your reaction to that?
Well, we'll see. So I think that it is if the vaccine is generated before that time, we all want a vaccine. A vaccine is going to be critically important as we continue our preparation for this virus. I mean, in discussion with other state health officials, I mean, we feel better if a vaccine has completed its stage 3 trials. Is that it completes all the testing for safety and effectiveness, and that is usually what we would expect from a vaccine and what we are expecting from this vaccine. Yeah.
It's been a week since you got a request from the DOJ for numbers regarding nursing homes. Can you update us on where that process is as far as getting numbers to DOJ or figuring out what exactly they're looking for?
We are working to comply with all of the requests from the Department of Justice.
Is there a time frame involved as to when that may be completed? Did they give you a time frame that they?
Not that I'm aware of, but really this is being handled by the attorneys.
Going back to the vaccine, could the state decide not to administer the vaccine if you felt like it didn't complete?
Yeah, it's very hard for me to speculate about what might happen a month or more from now and what testing the vaccine will have completed. So I think I'm going to stick with what I said before, is that, I mean, our expectation would be that the vaccine would have completed its safety and effectiveness trials.
And then just one other clarification about the compassionate caregivers.
Yeah.
That testing would need to be done before every visit, or is it like a weekly, monthly? How would that work?
I'm going to have to get back to you on that detail. I mean, I guess if they were going to come every day, I mean, we're not going to request a test every day, but we're going to have to get back to you on that detail. Good question, though. Yeah.
Can you just shed a little more light, though, on how you would expect it to work with a vaccine in a situation like this? Because, I mean, for one hand, yeah, I mean, I guess we see the state government often has a role with vaccines, but we also know vaccines, like people get a vaccine by their own choice from their own doctor. Like there's other routes.
Sure.
With a vaccine like this, how are you expecting it to play out in terms of, would the state, at least in the beginning, have total control of the vaccines, or could doctors be perhaps buying it on their own and offering it to their patients, or giving it to those who ask?
So so it's a very important question. So the distribution of the vaccine and then the administration of the vaccine is something that we are working on right now, that all the states are working on. We're doing a lot of collaborations with other states, and we have regular discussions with the CDC in terms of how the vaccine rolls out. I mean, what is the logistics of how a vaccine rolls out? Make a big difference if it's a vaccine that has to be frozen, or if a vaccine that doesn't have to be frozen. There's different chains of logistics for that, and then how we would distribute it, and then whether it would also be distributed, for instance, to pharmacies and things like that. So we are working out all of those details now. That whole logistical chain will be critical in terms of making sure that people get the vaccine. So we're working on all that now, and working it with the federal government.
Does it seem plausible at this point, though, say, if there was a vaccine that, like you mentioned, like, you know, you want a vaccine that has completed those phase 3, I think you said. Do you see a scenario, though, where you weren't comfortable with it, your department weren't comfortable with the vaccine, but the vaccine became available and it's available then in the state through other routes? Mm-hmm. Is that plausible?
So again, I'm not really going to speculate, because we're talking about well over a month, 6-8 weeks from now, and so we'll see the vaccine and what type of testing it's completed, what the recommendations are from the federal government, because it's going to come from the federal government and the companies, what the distribution, the logistics of that distribution will be to us, but also to pharmacies, to hospitals, to medical providers, et cetera. And I'm sure the federal government will have guidelines in terms of its administration, and we'll be working with them and other states on all of those guidelines. But it's not a good practice to speculate out 8 weeks in terms of different contingencies. The CDC has put out a number of different sort of scenario planning for us. And so we're working through those, and we're going to have robust discussions with our department and the CDC, as well as with ASTO, the Association of State and Territorial Health Officials, and the CDC. So those discussions have been happening, and they will be happening, but none of it's official yet. So we will see how that comes out. Yeah.
What role, if any, does Department of Health playing in helping out Department of Corrections on the state side and also counties who are having facilities, some with outbreaks? York County just said they had about 170 confirmed cases at their facility. What role are you guys playing, or guidance are you giving them?
Well, we collaborate with all facilities that have outbreaks. So that would include the Department of Corrections. That would include a hospital, and you had mentioned York Hospital. Of course, we also collaborate with county and municipal health department partners. York City has its own health department, and so we collaborate with them. But we are involved in all of those outbreaks. Yeah.
Is there specific guidance that you're giving prison facilities that may differ? I mean, obviously it would differ a bit from long-term care facilities, but are there any specific recommendations that you've given those?
Well, I mean, again, the basics are the same, right? So there are until there's a vaccine, there's two ways to deal with the spread of a respiratory virus like COVID-19. One is containment, and so that means testing. That means diagnosing those that are positive, isolating those people, then doing a case investigation, finding out who their contacts are, and then quarantining those contacts. So it would be that containment is containment. That would be implemented in a different way in a prison than it would, of course, be in a nursing home, but the principles are the same. And then there's mitigation in terms of working to prevent the spread, and that might mean, just like we've talked about, we've had, in the past, no visitors for nursing homes, and then we had a very careful strategy to allow visitors, and now we have a very careful strategy in terms of compassionate caregivers. Of course, that's going to be completely different in a prison, but it's always going to be containment and mitigation until there's a vaccine. Yes.
Can those compassionate caregivers still go into facilities that have not had any positive cases?
Oh, yeah. Sure.
Okay.
Yeah. Yeah.
Can you talk about what the public can expect when there is a vaccine being rolled out? Because I think that there's this perception that a vaccine will kind of be a cure-all, and that as soon as there's a vaccine that's approved by the federal government, then everyone will just get it and we'll be able to go back to life as normal. Is that the case? And what percentage of people will have to opt in, actually take up the vaccine for it to really be effective?
Sure. So nothing is simple in a world with COVID-19. And so as I've been saying, the distribution of the vaccine and then the administration of the vaccine is all going to have complexity. A lot will depend upon what vaccines come out. So there are vaccines that are cold chain that have to be kept frozen. There are others that have to be kept cold but not frozen, and there are others that don't. And so the distribution will be completely different for those three. In addition, there are vaccines that require one dose. There are vaccines that require another dose, a booster dose. And so what we're going to need to make sure is that people get, the right dose, and then that they get the right booster dose of the right vaccine. And so keeping track of all that will be really, really important. And we are making those plans right now, both with the federal government and with other states and with other stakeholders. What we don't know from from the vaccine is that will the protection be 100%? After a certain number of doses, if you're immune to polio, you're immune to polio. Or will it be that more like the flu vaccine, is that you have a certain amount of protection, but it's not going to be 100%, but it'll pretty much protect most people, and if you do get it, then it'll be much less severe. We don't know any of that about the vaccine. And so we also don't know how many doses will be rolled out and what period of time. So there are so many different questions, there are so many different variables, and I expect that there'll be answers to those as the vaccine rolls out, when it rolls out, but we don't have any of that information yet. But I can say that all of that work, all of that planning, all of those discussions are happening as they started in the summer, and they're happening as we speak here in the federal government and in other states.
How do you see this interacting with the anti-vaccine movement, which has some very vocal proponents in the legislature? Does your planning involve any like public education to remind people of the importance of vaccines?
Absolutely. I think that public education will be really important to reassure people that the vaccine is safe and that it's effective and that we should definitely get it. And I think that we'll need to work through individuals that are vaccine skeptics, that are concerned, and answer their questions and to be able to reassure them that it'll be critically important. It'll be very important. We don't know what the vaccine herd immunity will be. How many people need to get the vaccine in order for it to prevent the spread? I mean, since we don't know what vaccine it is, we don't know that number. We can make some guesses and estimates, but we don't really know. But we will as it rolls out. And so we're going to need to do a lot of public education, and we're going to call on you. I mean, I think that the media is going to be critically important to help us get the word out about the safety and effectiveness of the vaccine, as well as other vaccines, and the importance of getting the vaccine. So this will need to be a partnership with public health departments and with the media.
All right, that is all the time we have for today.
Thank you.
We can answer any questions on follow-up, or I can help you out, Taylor.
Thank you so much.
Tore them all to hell. Well, I got sick. I vomited and
Yeah.
here's a young kid, wanted so bad to get into the service, and I think when he got into the service, he realized he made a mistake. And we had all kinds of problems in Fort Bragg with him and on the ship coming over and stuff. He shouldn't have been there, really. And
Well, you all were young.
yeah, well, I was 18, you know.
Yeah.